Hi, everyone. Welcome to episode 9 of How to Become a Doctor. We're excited. Well, we do have a special guest today. I'm going to pass it off to them, but just wanted to introduce the topic of podiatric medicine. If you're not aware of what it is right now, you should be aware about by the end of this podcast. But anyway, thanks for coming out, and I'll pass it off to Mr. Bowen.
Yeah, so thanks for coming. We've been trying to focus on the last couple of sessions of our podcast on some other options besides the allopathic MD path, and there's some great opportunities in the health professions for students who are looking for something a little different or have some different goals or ideas about what they want to do. So today we're going to focus on podiatry and the podiatric medical field. So we have a guest with us today. So Jace Atuso is here with us. Jace is a LSU alum. He graduated from LSU with a kinesiology degree. And so we're going to let Jace, thanks for joining us. I know you're really busy. He's Jace's first year, so kind of a crazy busy time. So we appreciate you taking the time. And so I'm just going to let you introduce yourself and tell everybody who you are and a little bit about you.
Right. Well, first, thank you guys so much for having me. I'm honored that you thought of me to be on here. And hi, I'm Jace Atuso. I graduated from LSU, like Mr. Bowen said, in 2020. I majored in kinesiology. Took me about 4.5 years. I was also on the track team down here, so sports medicine was always a big interest of mine. And then Mr. Bowen offered podiatry when I went to go see him one day, and just my mind was pretty much exploded, and I loved everything about it, and I couldn't wait to start.
Yeah, so because you sort of started out like considering medicine, considering a lot of physical therapy, like a lot of different types of things. So once you found out about podiatry, what was it about podiatry that really made you that got you excited?
So one thing about podiatry was that I didn't even know that it was separate from MD at first. I thought it was all just kind of blended together. So when I found out that you could go in and immediately specialize in just foot and ankle, like right off the bat, I loved that. Didn't have to really mess around with all the other things, trying to figure out what I liked, what I didn't like. Had to go through the loops of everything. So if I just knew I could do that when I got in, and that's what I would be doing, it was just kind of like that faster route. Just it was much easier that way.
Yeah. So like with people who are interested in something like that's a good sort of segue. People who are interested in sports medicine or orthopedic surgery, those kinds of things, how does podiatry sort of fit in with that, or how does that offer that opportunity for people who do have that sort of interest?
Right. So like some people call podiatry the hidden gem, especially for orthopedic medicine.
Mm-hmm.
If you go to medical school, orthopedics is incredibly competitive. So many people want to do it. It's so saturated right now. So podiatry is kind of just like that hidden, like you can get that orthopedic feel, just not as much. So you get to do foot and ankle stuff. So, but you get to go all kinds of orthopedic procedures, bone procedures, dermatological procedures, all kinds of different things you could focus on. And then sports medicine, especially. So in Miami, one of my teachers is the sports medicine. He is the team doctor for the Miami Heat. And so just knowing that you have the ability to do something like that, that's one of the things that definitely was attractive to me about podiatry.
So, as an athlete, because you ran track here, you did cross country and all that here, was there, had you ever encountered a podiatrist? Like, had you ever seen one or been treated by one before you decided to pursue that?
Oh, yes, sir. I definitely had. So starting all the way back in middle school, I'd say I had a bunch of problems growing up with my heel and ankle, just the growth plate growing too fast, all this stuff, just causing a lot of problems. So I went to go see a podiatrist. One of my dad's friends actually is a podiatrist in Baton Rouge. So I went to go see him. He got me worked out and me fitted with the ankle, the heel cups and everything. And so after I did that, kept going. And then again at LSU, kept having more and more problems. So we finally, again, I went to go see him again. He got me right again. And so it's, again, seeing him through all these things, I still didn't realize that it was something separate until you had told me, which is crazy that we never made that connection, that podiatry was separate from med school like that. Even going to a podiatrist all these different times and seeing them, But then finally, when you told me, I was like, it makes so much more sense now. And so
Yeah, I think you're right. It's, the hidden gem is kind of a good way to describe that. And I don't think students don't really realize the opportunities of the different specialties that you can do, surgeries, diabetic care, there's just a lot of different specialty areas within podiatry. But I think there's only 9 podiatry schools in the entire country. And being in Louisiana, we don't have anything close by as far as podiatry. So Jace right now is in Miami in South Florida at Barry University. So just talk a little bit about that, about the application process when you were trying to decide where you were going to go, and the interview, and how you decided that Barry was where you were going to go.
So the application process is almost identical to the med school process. I was pretty much completely done with my whole med school application. And then Mr. Robbie told me about podiatry. So I just basically transferred my whole application to the podiatry site, and everything was, like I said, almost identical. So that made it pretty easy. Didn't have to change too much stuff. My statement of purpose was all still the same. They accepted all the same letter of recs. So that made it easy. So that's the easy part right there. And then once interviews came around, since it was COVID, I didn't get to travel anywhere. So I just did all my interviews like this on Zoom or WebEx or whatever program they were using at that point in time. And so I did probably, I think, 5 interviews total. And I think Barry was like my 3rd or 4th one. And so all the other ones were good. But the thing that stuck out about Barry was, number one, Miami. I mean, who doesn't like being this close to the beach? And from being from Louisiana, I didn't really want to go to New York or Temple, where it's super cold and snowy all the time. So I like the climate down here. So that was already kind of leaning me towards that way. But then once interview day came, Dr. Lucido, the team doctor for the Miami Heat, was in my interview with me, and he was talking to us all about sports medicine and all the things he does, and how he was working on LeBron and Dwayne Wade before the NBA finals, and then they won. He showed us his ring, and I was no question after that. That's where I wanted to go, especially if he's going to be teaching me surgery and sports medicine in my 3rd year. No question, that's where I wanted to go.
Yeah. So for students who don't know, like, podiatrists basically can treat anything in the lower extremities. So below the knee, basically shins, ankle injuries, foot injuries. And the training in terms of the education is very similar to the medical and dental field. So you have 4 years of the basic education. So you're in your 1st year. So just, can you kind of talk about what classes you're taking, what it's been like, in terms of the how the courses are managed, and just, that kind of thing?
Sure. So I'm currently in my 2nd semester, almost done with 2nd semester. We'll go back to the 1st semester. So in the 1st semester, we were in, I believe it was 20 credit hours. And so we had gross anatomy with a lab, histology with a lab. We had a biochemistry 1. We had a statistics and epidemiology research class. And then we had a class that was called Intro to Patient Care. And the Intro to Patient Care class was really interesting, because that was like our time to kind of get some in-clinic hours and to see patients. However, with COVID still being really prevalent, we weren't able to do much actually in clinic or with other patients. We were able to watch some surgeries. So like some of the doctors, they have this headset device where they basically live stream it to our class. So we were able to watch as they were doing the surgery. So that was really interesting to watch. We got to do that about once a month. And then gross anatomy, it was a 7 credit hour class. So it took up majority of our time, and we had to be in the lab about 6 hours a week. So that was basically what all of our time went into, was gross anatomy lab. And then coming over to 2nd semester, we separate gross anatomy and lower extremity anatomy. So in 1st semester, we do all basically hips to the head, and then all lower extremity. In the 2nd year, we do hips down to the feet. And so that's what we're in right now. We're doing all the feet stuff right now, all the really interesting stuff that we're all here to really do.
And so you have it's a cadaver lab and all that.
Yes, sir.
So I don't know if there's like a typical day for you, but like, can you just kind of walk us through like what your day is like in terms of like how long are you at school, that kind of thing?
Right. So last semester and this semester are pretty similar in my day to day. Mondays are by far my worst days. That's when most of my longest days, most of my classes are on that day. I have 3 classes that day, and that's this semester when one of my anatomy labs is. So I get to school at about 8 or 8:30. My classes start at 9. Do class from 9 to 12. Normally have a lunch break, 12 to 1. Then I go straight to anatomy lab at about 1, stay in there till 3:30, 4 o'clock. And then if it's a week where I have an exam that week or a quiz coming up, I have a study group, about 3 or 4 other guys. We normally just go to the library, get a study room, camp out in there until 8 or so, just getting our study, just doing whatever we got to do to get prepared for the exam. And that's Monday. So that's, like I said, the worst day. I'm at school all day on that day. And not every day is like that, obviously. If it's a pretty laid back week where I don't have, like this week in particular, I had an exam yesterday actually, and then I don't have anything the rest of this week or next week because that's my dead week before our finals. So I'm kind of relaxing the rest of this week. I don't have too much to do. I just go to class and I get to come home, not really worry about much studying or anything. So I get to kind of relax, take it easy. But if it is a week where I have an exam or something, I like to study with my study group at the library, but not always. It depends on the class. So if I'm if I'm in the library with my study group, we'll stay in there until 9 or 10 sometimes. So you just lose track of the time. You're just studying. And it's much better if you study with that group of people because you kind of all suffer together. And so that builds that bond and it just makes it a little more bearable as you go on. And then that's normally a typical week studying most of the days, but I do have free time though. I'm not always studying, especially when I get home. If it's like 8 or so and I feel like I've studied a lot and my exam's done out for a couple of days, I'll come home, I'll watch TV or I'll play on my Xbox or something just for like an hour, just kind of decompress, eat dinner, and just get that relaxation time out to where I'm not constantly stressing about school all day, every day.
Yeah, so that was going to actually be my next question. So you do have time to kind of, have some fun on the weekends or do kind of explore Miami or whatever. So
definitely, yeah, we definitely get some time off. We're not always studying every single day. A lot of our exams end up being on Thursdays or Fridays, and so after we finish an exam, we'll get ready. We'll go out that night. We'll go to a bar. We'll get some drinks. We'll just kind of relax as a class. And so we do get some time off is to just get that relaxation time that is much needed. And if you don't take advantage, you will just lose your mind.
So can you talk a little bit about the class? Like how big is the class? I mean, is it, mostly male, half and half? Kind of what's your class makeup?
Sure. So at Barry, we actually have one of the smallest classes out of all the podiatry schools. Our class is, I believe, 64 people right now, and it is almost a dead split, half and half male and female. I think there may be one more female or one more male, but we're almost a dead split.
Wow. Okay. So you mentioned clinics, like when in the, I know COVID's kind of screwed things up, but like when would you normally be able to have your first interaction with a patient or to, come face to face with a patient?
So like I said, last semester with that intro to patient care class, we were supposed to normally, if COVID's not a thing, you normally are supposed to about once or twice a month get some in clinic hours and get to like watch, basically shadow a little bit, but actually get to see real world experiences we have our own specialty clinic at one of the hospitals that Barry particularly works out of. And so, like I said, we're supposed to get some then. This semester, we aren't planning to get any. I believe in the fall, however, we do start to see some real inpatient clinical rotation type stuff.
So for students who don't know, can you just kind of talk about the process of like, the first 2 years of school, the second 2 years, and then what happens after the fourth year and all that?
Sure. So how a lot of people like to think of it is the first 2 years are your main didactic classes, which is going to be everything that's going to be on. So for us, we take boards part 1 after our second year, which is very similar to the step one that med school takes. And so your first 2 years is all basically preparation for that test, how you're going to, all the basic, like I said, biochem, anatomy, neuro, all those basic classes that are going to be tested on that test, you cover in your first 2 years. And then after you take our boards part one or step one, if you pass, you continue on to your third year. And then your third year is when you really start to do your rotations and being in clinic way more than being in class. I think in third year, you're only in class 1 day a week and you don't get really tested that often. It's more performance in clinic and just making sure you keep up with your schoolwork so that you know what's going on in your clinic. And then fourth year in podiatry, I'm not sure how it works in medical school, but I think it's kind of similar. In fourth year, we do what are called externships, where for 1 month at a time, you travel to a place that you may be interested in doing a residency. And you kind of do like a month-long application process there where you stay there the whole month and you work and you basically just act like you're starting your residency there. And so it's kind of like your application. And so we have to do 8 of those. So that takes up 8 months. And that's basically what all of fourth year is. And then you do your applications for residency and then you get matched and then you continue on after that.
And so can you talk a little bit about what the specialty areas are, like what your options would be in terms of once you finish your 4 years, what are some of the options of like further study or specialty areas?
Definitely. So with podiatry, it's not all just surgery based, or there's so many different specialties you can go into, from diabetic wound care. You can specialize in trauma, being in the ER. You can specialize in kids and podiatrics, as they call it. You can specialize in dermatology, which you actually see a lot of like cancer patients who have some kind of thing going on their foot. And, or you can just go the normal route where you just do kind of a little bit of everything. And so after you do your residency, you can actually continue on your studies and do a fellowship where you can specialize, and that's where you would do your sports medicine or anything that requires some like real specialty that maybe you didn't get enough of in residency that you wanted to get a little more practice in before you go out and practice on your own.
So I know it's early, but do you know what you are leaning towards or what you think you want to do?
I definitely am interested in sports medicine still. And I've always had an interest in like pediatric medicine. So like podiatrics is still a big interest of mine. So I'm not quite sure yet, but I got a few ideas.
Yeah, cool. So, I mean, you were a good student, so you kind of, were well prepared, but what is it? Is it what you expected? Is it harder than you thought? I mean, do you feel like you were prepared for what you were sort of thrown into once you got there?
Yeah, a lot of classes at LSU definitely did prepare me the right way. I think some classes at LSU maybe prepared me too much, because some of them are just, it's not that intense as they said. They were just trying to scare me, I think. But yeah, LSU definitely prepared me for what I needed. It's some classes are definitely way harder than I thought. I have to put in a lot more time than I expected to in some classes to really just understand just the baseline of some of the things. So I'm definitely studying a lot more, but I don't really see it as like a chore because it's all stuff I'm finally interested in. While at LSU, I felt like some of the classes I was taking, I was like, why am I in this class? I'm not really interested in this thing. But I know with all these classes, they're all getting me to where I need to be and where I want to be, which is studying the foot and just how to really help and make people better.
Yeah. Are there any particular classes that you are glad you took or that you thought were helpful or that you wish you had taken while you were here?
For me, being a kinese major, I wish I would have taken like a histology or a cell biology class. I feel like that definitely would have helped me, especially in that first semester histo class. A lot of it was just kind of all new and almost foreign to me. So I wish I would have gone back and taken one of those classes, maybe even like a pathology class of some sort, or just something a little more specialized like that. Because being in kinese, do a lot of just more general body movement stuff. And so we're going to get into a lot more of that next year, especially with our biomechanics classes and everything. But for those first semester and first year classes, I feel like it would have been beneficial.
Yeah. So so you're away from home. You're down in Florida, and I know your family and everybody's still here, and your fiance and all that. So, I mean, have you had time to, you know, have you been able to come home, and do you have time to, sort of see your family and all that kind of stuff? As crazy as things are.
Yes, sir. So especially for any holiday, I can go home pretty easily. So for Thanksgiving, we had the whole week off. So I actually left on Thursday. I missed my class on Friday, but I watched it. I watched it while I was at home. So I left Thursday. I went home. So I was home for about 8 days. So that was a nice little break. And then Christmas, we were off for 3 weeks. So I got 3 weeks at home there. And then we had spring break. That was about 3 weeks ago. I went home for spring break for the week. We got Easter break coming up next week, actually, but I'm just staying here for that one because that's right before our finals week. So I'm just going to kind of stay here and study for that. And we only get the Thursday and Friday off. So I could go home if I wanted to, but I just will stay here, just kind of make sure I get all my studies down.
Yeah. So that's not bad. I mean, that's some good break time. Do you get the summer off, or what are you going to be? Well, I know you get married, but what are you going to be in school?
Yes, sir. So we finish this semester on April 29th is our last day of finals. And then we get 2.5 or 3 weeks off. And then we start our summer classes. Summer load's not as intense. I think we're only in 8 or 9 credit hours. So that's only like 3 classes or so. So it's not too intense. And that goes on from, I believe, like May 17th or 18th to end of July sometime. And then at the end of July, we get another 3 weeks off before we start the fall.
So what are the faculty like there? I mean, do you feel like, they're approachable? How's the attitude and the atmosphere of the class?
Most of our classes are pretty well run, I'd say. A lot of the professors, especially my biochem professor, I mean, he's always just like begging people to go and talk to him, just make sure everything that we may need, they can help us in some way. They're always looking for ways that they can help us and reach out. Some professors aren't the best, I'd say. They're a little more intimidating, if you might. They just seem like they're that cold. But once you really get in and like, especially if you go to their class, make it a point to make yourself known to them, they'll open up so much, and just the amount of things and ways that they can help you out if you just make it a point to reach out to them. Mm-hmm. That's the key. That's the difference, is reaching out to them and just making sure they know who you are, know your face, and just kind of know a little bit about you.
Yeah. So I know you were talking before we started about, just traffic and things like that. So what's, give us some insight into like life in the Miami area.
Yeah. So life in Miami is way faster than life in Baton Rouge. It is everywhere you go, you're shoulder to shoulder almost, like just going to the grocery store. I didn't realize how much of a problem it would be, but if I go to Target or Publix right by my apartment, I'll be waiting for 10 or 15 minutes just to check out at the lines and the parking lots and just trying to get places. You're always waiting in a line.
Yeah. So what's your campus like? Or is it a standalone school, or are you on the undergrad campus?
So, yep. So Barry is actually one of the only podiatry schools also that is attached to a major undergraduate campus as well. So our podiatry school is just located just on the other side of campus, but our cadaver lab and the library is right in the middle of the undergrad campus. So we get to see all the undergrad students every day, and we walk through all the same ways they walk. So that's another reason I was kind of more leaning towards Barry, was that you still had that college feel. You weren't just kind of in your own building, just like stuck off somewhere. You had that feel of like other people around you, like you were still in some kind of community of some sort.
Yeah. So you have like food and like recs and stuff like that on campus that you can participate in?
Oh, yes, sir. So we have a union. It's not nearly as big as LSU's, but we got a union with cafeteria, plenty of food. They have almost like a UREC type thing, just a little gym. And then me and some of my friends are actually on the intramural team, so they allow us to do intramurals. So we did volleyball in the fall. We're doing flag football right now. So we get to still participate in everything.
Cool. Okay, so Matt, is there any other questions that we have?
I mean, we covered a lot. I guess the one other thing is just starting about your timing of starting schools? Like when was your first day down there last fall? And when's it maybe a good time to move down to prepare for that first day?
Right. Yeah, that's a good question. So the way I actually did it, we didn't start until about August, I think 10th or so. I think August 10th is about when we started. And so I actually moved down. My parents and my family, they helped me move down about first week of July. So we moved everything down here, got my apartment ready, and then we stayed here. I stayed here the whole time, and then they came and went. So my fiance came and went. My parents, my mom, dad, they all came and stayed with me a little bit in that 3 weeks. But that 3 weeks before class started was me just kind of getting acquainted and used to everything in Miami. And I feel like that was definitely super beneficial if you have that opportunity to move down early before you start, just kind of get acquainted everything. Make sure you know the roads so you're not trying to scramble and find everything just a day or two before.
Awesome.
Yeah, so I promised you we'd only keep you 30 minutes. I know you're busy, so we appreciate your time. But can you just finish up by just if the student's thinking about maybe I want to look into podiatry, I mean, what advice would you give them, or why should they think about podiatry?
Yeah, so like I said, again, podiatry is that hidden gem. Not many people know about it. It is super unknown, and podiatry needs more people in it, like who want to be like real, like good doctors. We need more people in here who are going to really do a good job. They're not just here just trying to get that title. They want to really come in and help people the right way, and definitely just do your own research on it. Make sure it's something that you want to do. Make sure you are okay with dealing with the foot and ankle and seeing a lot of diabetic patients as you go on with your day, because once you're in, you can't change up. Like if you're in med school, you can't change to some other specialty. You're stuck with the foot and ankle. So make sure it's something that you really want to do, and then we'd love to have you.
Okay, Matt, anything else?
I'd say that. Thank you so much, Jace.